Hi everyone. So this is the part 1 video of upper limb anatomy. So here we are going to study about the forearm muscles. So as we all know that the forearm muscles, it is divided into an anterior compartment and a posterior compartment. Okay. So yes, I will discuss in detail. So this is the forearm muscles. Forearm muscles, it is divided into an anterior compartment and a posterior compartment. So this anterior compartment muscles are called as flexors. Okay, flexors, and these are the extensors of forearm. Okay. Then these flexors are again divided into superficial, intermediate and a deep layer. And extensors are divided into a superficial and a deep layer. So this is the muscles of forearm. It is divided into an anterior and a posterior compartment. And anterior compartments are flexors and posterior compartments are extensors. Okay, anterior compartment, these flexors are again divided into superficial, intermediate and deep layers. Extensors are divided into superficial and deep layers of muscles. Okay. Yes, coming on to the anterior compartment. So it comprises of flexors, as we all know, right? Yes. So coming under, this is the superficial compartment. The first layer is superficial layer. It is not a superficial compartment. It is superficial layer. So the first one is pronator teres, and then comes the flexor carpi radialis, and we have palmaris longus, and we also have flexor carpi ulnaris. So first is pronator teres, right? So one thing you want to note is that all the superficial and intermediate layer of the anterior compartment, it all arises from the medial epicondyle of the humerus. All the superficial as well as the intermediate layer of the anterior compartment arises from the medial epicondyle of humerus, which is a very important point. So we are only now concerned with the insertion. Right, yes, the first one is pronator teres. So this is a pronator teres, okay, this is the pronator teres. This yellow color muscle is the pronator teres. Of course, it originates from the medial epicondyle of humerus, no doubt in that, right? Yes, and what about the insertion? So insertion, so this is the ulna, right? Here comes the ulna and here comes the radius. So it is inserted into the mid shaft of the radius. Okay, as we all know, this figure denotes that it inserts into the mid shaft of the radius, which is very important. The next is flexor carpi radialis. So this green color muscle is called as flexor carpi radialis. Of course, it originates from the medial epicondyle of the humerus, and it is inserted into, okay, second and third metacarpals. It is inserted into second and third metacarpals. Then comes the palmaris longus. What does palmaris longus do? Palmaris longus, it arises from the medial epicondyle and it is inserted into the palmar aponeurosis. This blue color muscle, it is inserted into the palmar aponeurosis. And then comes the flexor carpi ulnaris. This is the red color muscle. It originates from, of course, the medial epicondyle of the humerus, and where it is inserted. It is ulnaris, so it is inserted somewhere here, that is pisiform, hamate and fifth metacarpals. Is that clear? So if it is radialis, it is inserted somewhere here. Okay, somewhere here. On the lateral side, radialis denotes the, radialis is like, it is adjacent to thumb. Just think like that. Radialis, radius is here. So radialis, radialis, radial nerve and thumb all comes in a single line. Is that clear? Yes, all are in the lateral side. Then we are talking about ulnaris, ulnar nerve, okay, and the little finger. All comes in a one line. It is in the medial side. Is that clear? Yes. So yeah, you can relate it and write the insertion origin for your own. Okay, just don't by heart. It won't be stay so long. So just think and write. Then, okay, what are the functions of these muscles? So, pronator teres, of course, from the word itself, pronator teres, from the name itself, it is pronator, right? It is do pronation, of course. What flexor carpi radialis do? Flexor carpi radialis, of course, it is flexion, okay? Flexion of wrist, of course, it is flexion of wrist, because it is getting and inserted into the beyond this part, right? So it will be the flexion of wrist only. So flexion of wrist, and also it does as a function of abduction. Okay. And what does palmaris longus do? Palmaris longus do the flexion itself, but a weak flexion. And what does flexor carpi ulnaris do? It also does us the function of wrist flexion along with the adduction. So this radialis do abduction and ulnaris do adduction, which is a very important point. So that's about the superficial layer. We have pronator teres, we have flexor carpi radialis, it goes on to this side, and we have palmaris longa, middle side, and also we have flexor carpi ulnaris. Is that clear? Yes, and the functions are also clear, I guess. And then one more thing, this is brachioradialis muscle, guys. This is brachioradialis. And this is, we all know, pronator teres, this yellow color muscles. So this makes a structure, this makes a base of the structure called as cubital fossa. This is a base of the cubital fossa. Okay, cubital fossa, it is formed by the medial side of this, medial border of this pronator teres along with the lateral border of this brachioradialis. Brachioradialis comes under the extensor compartment, which we will be studying later, and cubital fossa also we will be discussing. So that is all about superficial layer. Coming on to the intermediate layer, we only have a single muscle over here. That is none other than, that is flexor digitorum superficialis. So it is superficialis, it is superficial. So something is there in the deep, right? Yes, that is flexor digitorum profundus. The word profundus means like deep. Okay, we have a superficialis, so we will be also having a deep muscle also. So that is flexor digitorum. Of course, it is a flexor. By the name, it is a flexor, of course, of the digits. It is inserted into the digits, and then comes the superficialis. It is superficial. From the name itself, we want to understand something at least. And what is the origin? Of course, it is medial epicondyle. And what will be the insertion? Of course, it is digitorum. So it will be inserted into the digit. It is middle phalanges of the digits. Second to fifth. It is second to fifth middle phalanges of the digits. Okay. And what is the action? Action is that flexion at the proximal interphalangeal joint of the fingers. It is flexion of the PIP, proximal interphalangeal joint. Okay. So that is all about the intermediate layer. Origin as common as the superficial layer. Insertion, I guess you got it. Yes. Then comes the deep layer. We have the flexor digitorum profundus. The superficialis we discussed before. And here it is profundus. And flexor pollicis longus. The pollicis you always related to thumb. Okay. And we have pronator quadratus. It is quadrilateral or a rectangular shaped muscle. So that's why quadratus. And then we have the flexor digitorum profundus. Okay, we have the flexor digitorum profundus. Of course, it is going on to into the digits. Okay, so what is the insertion? It is introitious membrane and also ulna. And it is inserted into the distal phalanges. Here it is inserted into the proximal phalanges. Sorry, middle phalanges of the digits. So here it is inserted into the distal phalanges of the digits 2 to 5. And here what is the function? It is flexion at the distal interphalangeal joint. Here it will be the function of the proximal interphalangeal joint, and it is also inserted into the middle phalanges. Profundus will be inserted into the distal phalanges and the flexion of distal interphalangeal joint. So that is all the difference between the flexor digitorum profundus and flexor digitorum superficialis. Coming to the flexor pollicis longus, it is originated from the radialis and introitious membrane. It is inserted into the distal phalanx of the thumb. Okay, it is something to do, there is pollicis, right? It has something to do with the thumb. So it will be inserted into the distal phalanx of the thumb. So, of course, what is a flexion? It is flexor pollicis, flexion of the thumb. That's all about the flexor pollicis longus. And then we have the pronator quadratus. What is pronator quadratus? So that is the distal, it will be originated from the distal ulna. Okay, and it will be inserted into the distal radius. Okay, it is a quadrilateral shaped muscle. So what about the nerve supply? We already discussed about the origin, insertion of flexors of the forearm, right? Yes. And also its action. So now we are going on to the innervation. So what about the nerve supply? Ulna, we are having two nerves, that is ulnar nerve and a medial nerve. So ulnar nerve will be supplying only to one end of muscles of this anterior compartment, that is ulnaris, of course. Flexor carpi ulnaris, ulnar nerve will be supplied, and also flexor digitorum profundus. Only the medial half of the flexor digitorum profundus is also supplied by the ulnar nerve. Only one end of muscles. The rest, all these muscles, all these remaining muscles are supplied by the median nerve. So I hope all of you understand this topic. So next is posterior compartment. We'll discuss in another video, next video. So yeah, thank you for watching. And please, if you at all you understood something, please do like and subscribe my channel.